Hi, I'd like to welcome you to this course in psychopharmacology. My name is Dr. John Preston. I'm a professor at Alliant International University, and I teach in the clinical program, in the MFT program, and then in our postdoctoral master's degree program in clinical psychopharmacology. And I want to take just a minute or two and tell you a little bit about myself. I'm a psychologist, I'm a neuropsychologist, and actually most of the work I've done in my career has been as a psychotherapist. I have been teaching courses in neurobiology and psychopharmacology for the last 30 years, and I've taught to graduate students and at the UC Davis Medical School, so it's an area of interest of mine, although I consider myself primarily to be a psychotherapist. And so the reason I'm mentioning that is because courses in psychopharmacology are going to differ somewhat depending on the professional who's teaching the class, whether it's a pharmacist or a psychiatrist or someone who does a lot of psychotherapy, so you're bound to get some of my biases in that direction. I've also worked inpatient and outpatient mental health for many years and now teach full-time here at Alliant International University. I'd like to, again, welcome you to this course, and I think an appropriate place to start is for me to read you a quote. This is from a guy by the name of Burnwell. He was a physician back in the 1930s and 40s, and he says, "Half of what medical students are taught in 10 years will be shown to have been wrong. The problem is that none of your teachers know which half." And that's absolutely true. We're going to be seeing that there's a lot of information that's based somewhat on fact, but lots of theories. And a lot of theories we're going to be talking about are absolutely subject to revision as new information comes along. So this is kind of like trying to shoot at a moving target in some respects. In this course, we're going to be talking about some very practical applied issues with clinical psychopharmacology, but we're also going to be talking about theories that are subject to change. What I really want the student to understand is not only the practical current clinical issues, but also to become skeptical about the role of psychopharmacology as in any other kind of treatment. There are limitations. This is true across all branches of medicine and all forms of psychotherapy. And I think we need to become good researchers at looking at the research and take into consideration the limitations of research when we evaluate the efficacy of medication in the treatment of psychiatric patients. So, welcome to the course.